The chair recognizes the gentlewoman from California, Ms. Porter, for 5 minutes.
Madam Speaker, I ask unanimous consent to address the House for 5 minutes and to revise and extend my remarks.
Without objection.
Kids and teens are facing a mental health crisis. In Orange County, the hospitalization rate for children's mental illness and substance use disorder increased 88% between 2010 and 2019. Just last year, our children's hospital saw a 40% increase in mental health admissions in its emergency department. On March 2nd, National Teen Mental Health Day, we recognize that caring for mental health is a part of raising and educating our kids. Communities should support children's well-being before mental health issues become crises. In Orange County schools, like the ones my kids attend, that work has already begun. Using funds from the American Rescue Plan, the Irvine Unified School District has hired qualified mental health specialists. These professionals are dedicated resources for mental health recovery, and they allow counselors to focus on academic issues and peer relationships, and teachers to focus on education. Together with the Children's Hospital of Orange County, schools are building safe, comfortable places for students to heal. These retreats, called Well Spaces, are supported by mental health professionals and help students with the pressures of being kids. Well Spaces are an innovative way to ease the transition to in-person learning after pandemic school closures and to teach mental wellness skills. Just like with physical health, even the best prevention tactics do not eliminate emergencies or stop chronic illnesses. For kids that need more care, CHOC offers world-class treatment. CHOC's intensive outpatient program keeps children living at home with their loved ones and allows them to remain in school. This healthcare delivery keeps kids connected to their families and their teachers. CHOC built a pediatric inpatient center to get younger kids the acute care that will help them have healthier teen years. Mental health care providers are moving mountains to care for our kids. Thanks to the work of dedicated professionals and health centers like CHOC, raising a family in Orange County means our kids will have the resources to stay healthy, mentally and physically. But these resources mean little if families cannot afford them or if insurers refuse to cover them. That's why I'm making sure that big insurers follow the law and cover mental health care. I'm proud that my bill, the Mental Health Parity Compliance Act, was signed into law in 2020. This legislation provides tools to enforce the requirement that insurance companies cover mental health care the same way they cover physical health. Children need lawmakers to prioritize their well-being, including mental health care. This means supporting high-quality, innovative programs, increasing connections between families, schools, and healthcare providers, and closing loopholes used by insurance companies to deny families affordable mental health care. The youth mental health crisis will not improve without investment in care. As an Orange County mom, I'm proud that my community is leading the way in responding to the youth mental health crisis. Our younger generations are counting on us to help them toward health and wellness, and I'm committed to working across the aisle to get that done. When my 1-year-old daughter, Betsy, went to daycare, I was worried. My family was in upheaval with a divorce, and Betsy was new to childcare. But when the door opened, Betsy was scooped up in a hug. Irvine resident Nazi Shabazian provided Betsy with years of fun but firm guidance, painting, racing cars, dancing, and even snacking on Persian cucumbers. A single parent herself, Nazi inspired me by successfully running her small business and raising 2 terrific daughters. During the pandemic, she adjusted to new health protocols, employee changes, and different parent schedules. Today, her business, Melody Childcare, is thriving, and so are the children in her care. Nazi is an exemplar of the compassion and resilience that childcare providers and small businesses showed during the pandemic, and I am proud to honor her as my 2022 State of the Union guest.